288th session of the Developmental Disabilities Lecture Series. Today and this spring, we thank you for joining us virtually. The lecture series is a semi-annual continuing education activity of the Boggs Center, New Jersey's federally designated University Center for Excellence in Developmental Disabilities, and New Jersey's Leadership Education in Neurodevelopmental Disabilities program. We gratefully acknowledge support for the series, which comes from the New Jersey Division of Developmental Disabilities and the Administration on Intellectual and Developmental Disabilities in the U.S. Department of Health and Human Services. The Boggs Center is committed to supporting the developmental disabilities community in New Jersey as we face the coronavirus pandemic. We want to call your attention to COVID-19 resources that you will be able to find on the Boggs Center website. These include general information, information accessible to people with developmental disabilities, and information on mental health and self-care support. There are also, the resources are in English, but many are also in Spanish. Before I introduce our presenter, Ann Rue, I want to share a few details about the webinar format. You will automatically see the presenter slide on your screen during the webinar. If you would like to download slides and handouts, go to the handouts section of the control panel on the right of your screen. The handouts will also be posted on the Boggs Center website next week, along with a recording of this webinar. We are planning to have a brief question and answer session at the end of the lecture. In order to ask a question, you have to type it into the question section of the control panel. All attendees are muted and will not be able to ask a question verbally. We encourage you to type in your questions during the presentation, as the question period will be brief. We will try to raise as many questions as possible following the presentation. We are pleased that we will be able to offer continuing education credit for this webinar. To receive a certificate of attendance for continuing education recognition, you must be logged into the webinar from start to finish and complete the evaluation at the end of the webinar. Certificates will be emailed to attendees who meet these requirements next week. Before we proceed further, I must take this opportunity to recognize and thank Robin Carroll, Boggs Center Communications Manager, Zaber Ajman, our technical whiz, and all the Boggs Center staff and faculty who have brought us into this virtual world in these difficult times. This session of the Developmental Disabilities Lecture Series is being held in recognition of April as Autism Awareness Month and is also a continuing education activity of NJ Lend. Autism spectrum disorder is a lifelong developmental disability characterized by deficits in social communication and interaction, as well as restrictive, repetitive patterns of behavior, interest, or activities. The Centers for Disease Control and Prevention's latest estimates indicate that the prevalence of autism among 8-year-olds has increased nationally to 1 in 59 children, an increase from 2014 of increased nationally to 1 in 54, an increase from 2014 of 1 in 59. In New Jersey, the prevalence is now reported as 1 in 32 8-year-olds, remaining the highest reported rate of autism in the country. According to the 2018 National Autism Indicators Report on high school students on the autism spectrum, co-authored by today's presenter, Nationally, an estimated 728,000 young people with autism will enter adulthood in the next decade. Based on the US Census data and estimates of autism prevalence, between 50,000 and 60,000 youth with autism will age out of their school entitlement each year across the country. The end of the education entitlement produces a steep drop-off in access to supports and services. Many emerging adults with autism experience poor outcomes in employment, higher education, healthcare, social inclusion, and independent living after leaving school. It is my pleasure to now introduce Ann Rue, our presenter today, a research scientist at the A.J. Drexel Autism Institute's Life Course Outcomes Program at Drexel University, where she studies life course outcomes of youth and adults on the autism spectrum. Much of her work focuses on understanding on how transition-age youth are faring in employment. Ann is an author and producer of the award-winning National Autism Indicators Report series, which has informed federal reports and policy on transition-age youth with autism. Over the course of her career, she's built a portfolio of clinical expertise in early intervention, nonprofit leadership, and advocacy at the state level, as well as research publications, all of which are focused on improving the lives of individuals with autism. Ann has family members who are on the spectrum and brings the firsthand understanding of the urgent need for science that is aimed at improving people's lives. A heartfelt DD lecture series virtual welcome to Ann Rue, who will present to us today on a life course perspective on autism and the transition to adulthood, using population level data to inform policy and practice. Welcome, Ann Rue, to Virtual New Jersey.
Good morning, Dr. Spitalnik and everyone online. I really appreciate this opportunity to speak to you all today. And while I would far rather be in New Jersey in person meeting with you all, I'm grateful that technology allows us to be together virtually today. As Dr. Spitalnik said, I have been involved with serving individuals on the autism spectrum and their families for the last 25 years. And I have worn a lot of different hats across this time. But I also wear the hat of family member of individuals with autism. And this is what drives my passion for improving the transition to adulthood most of all. So just a little personal context. While I live in Missouri, in St. Louis, my work is in Philadelphia. About 8 years ago, Dr. Paul Shattuck was asked to start a life course outcomes research program at the A.J. Drexel Autism Institute in Philadelphia, because of the dire need to focus on what is happening to youth with autism as they age. So while I was previously doing autism research work with Paul in St. Louis, I now work remotely as part of our Drexel team, just as so many of you are now currently experiencing the joys and challenges of working remotely. So I'll be talking today about the statistics and initiatives that have emerged from the work of our team. And some of what I share may be statistics that you are very familiar with, maybe that you've heard in the media. But I've tried to add a lot of new information from our more recent studies. And I will, of course, be talking about our transition programs at Drexel toward the end of the talk. So hang in there with us. So I'm not going to talk today about what autism is, or how we came to have an increase in persons diagnosed with autism. I'm going to trust that you are familiar with that information. Before I launch into my talk, though, I do want to step back and share a few thoughts on the big picture. First, autism is challenging. It's challenging to have, to parent, and to teach. It is complex and multi-systemic, and it is typically accompanied by other conditions. Second, the challenges of autism are not experienced equally across the spectrum or across families. Life differs depending on where you're located geographically and socially, and these factors can influence services and how life turns out. So this can lead to an accumulation of challenges, and sometimes life can go downhill. And if you take away nothing else today, I hope you remember that autism is important for us to be aware of that and to address it. Third, diversity requires diverse solutions. There are no one-size-fits-all solutions to fit the entire autism spectrum or the strata of different family situations. Social systemic challenges aren't fixed by simply having effective therapies to address the issues of individuals. There are underlying issues in our service system that need system-level solutions, and that will be a big focus of what we talk about today. Fourth, as you might expect, the statistics I share with you are mostly not good news. And those among you who are adults on the spectrum or family members will relate because you live this talk every day just as I do. But I will tell you that these statistics are still super important for program planning, for grant writing, for policy making, and for advocacy. But beyond statistics, what we are most interested in at our program is in unleashing human potential through the creation of jobs, of inclusive communities, and systems that actually work to improve lives. So hang in there with me through the beginning of this talk because we will get to some ideas and solutions later on. So formally, our mission at the Life Course Outcomes Research Program is to build a base of knowledge about the social determinants that influence services and outcomes across the life course. And put more simply, this means that we want to know what factors affect how people on the spectrum are faring in their lives. And we do this by analyzing population-level data, which we will talk more about in a moment. So that's on the left side of this slide. But we don't stop at statistics. We also innovate program models for inner-city youth in the Philadelphia area and elsewhere. And we focus on building capacity of communities and employers and systems. And we promote and model collaborative community-based solutions by helping our community partners to make connections instead of working alone in what we have referred to previously as silos. This last bucket of efforts on the right side of the slide is also called collective impact, if you're familiar with that term. So why are we here today? I assume some of you are at home in your PJs listening to this webinar. We're here because we spend billions of dollars each year in the US for services for people on the autism spectrum. And we know that positive adult outcomes are possible and they do occur, maybe as a result of the billions that are spent. However, the reality is that poor outcomes occur for most adults on the spectrum. And we have few ways to think about fostering or measuring population level progress. There are solutions that are being created in our communities for smaller groups of people, but we need to look toward bigger solutions that will move the needle on outcomes for more people. So in our time together today, I will be focusing on two things. The first is understanding the state of the science, and the second is learning about policy and practice level interventions that might improve outcomes. And I want to acknowledge before we start that we are thinking forward today. We're thinking past the current chaos and thinking toward a period when we hopefully return to normalcy sometime soon. And I know that service delivery options have changed drastically at this moment in time, and that transition is difficult to provide remotely. But I just want to encourage everyone to just take a break for a moment from the news, from all of the thoughts racing through your head about COVID, and just allow ourselves to think about what we need to do to improve services in the not so distant future, because that day will come and we will get back to the point where we can think about programs as they have previously existed. So specifically, we're going to talk today about data that can be used to inform programs and policies. And I'll be sharing data that comes from existing national surveys, from state documents that we analyze, and from interviews that we have conducted. And much of what I share about programs comes from our team's learning via the Transition Pathways Initiative at Drexel. The Life Course Outcomes Research Program is made up of folks with backgrounds in public health, in sociology, in social work, and a public health approach is the basis for our thinking. But what does public health have to do with autism? In 2020, there's really no question that teens with autism often leave special education only to have difficulty connecting to work, to continued education, and to services as they enter adulthood. And some describe this decline in services after high school as a, quote, cliff. I'm sure you've heard that term before. And I could ask you, or you could ask me, how should we head off that cliff? And that's the reason probably a lot of you are here today to hear about that. How should we do it? But for any given social problem we want to work on, it can be useful to first ask why we don't know more already about this. Why aren't we further down the road? Why aren't we preventing this cliff? And asking the why questions is one of the tactics that we use to stay anchored in an evaluation mindset, which comes from the fields of social work and public health. Why questions put the spotlight on social systems, on institutional structures and processes that intentionally or unintentionally serve to perpetuate the status quo instead of us driving continually towards improvement. So it's not the case that every individual on the spectrum who is unemployed has failed in some way. Rather, it is the case that our system of care is fragmented and broken. So this attempt to answer why questions is part of a public health approach to autism. And the A.J. Drexel Autism Institute is the first research organization that is built around a public health science approach to understanding and addressing the challenges of autism across the lifespan. So this includes several aspects of programming. We have a modifiable risk factors program at the Institute that focuses on why does autism occur and who does it affect. They look for triggers that cause autism genes to express themselves, risk factors such as air pollutants. And then we have an early detection program which designs and implements and evaluates early screening and intervention programs to see what works for different groups of people. And they answer questions like, how do we identify autism as early as possible, and how do we deliver effective early intervention? And then our Life Course Outcomes Research Program tackles questions like, how does life unfold for people on the spectrum across the lifespan? But we also seek to measure how programs are working, such as transition programs. And we focus on efforts to move the system, not just single interventions or programs, but we are trying to find the blockages in the system so that we can answer the why question of why are we not preventing this proverbial cliff. So a quick clarification, why are we talking about health and public health if our topic is transition? You will hear me use the word health today, and when I talk about health, what I mean is well-being. And when I talk about well-being, what I mean is happiness, meaning, self-realization. That's easy to think about in terms of employment, that we want people to have meaningful jobs that helps them achieve their potential. So in our work, we are specifically interested in population health. A population is a group of individuals. It does not necessarily refer to the individuals themselves. So population health is the health outcomes of a group of individuals, and it includes the distribution of such outcomes within the group. And that sounds a little bit like the mission I shared with you earlier about the Life Course Outcomes Research Program. Arlene Stiffman is now a retired professor She was at Washington University in St. Louis, where Paul Shattuck and I were. And she was a well-known champion of using a public health approach to address children's mental health. And this is how she defined public health approaches: the protection and improvement of community health by organized community efforts, including prevention, screening, and treatment, as well as environmental and social interventions. And every time I see this definition, I'm really struck by the breadth of those efforts. So you are already familiar with a public health approach because it underlies the current stay-at-home orders in states across our nation. And we are all about to see probably the most vast example of public health screening that will likely occur within our lifetimes as we attempt to surveil the COVID-19 status of our population. So you're already familiar with this type of approach because you also see it in our vaccination programs, our use of seat belts and car seats. These are all universal programs that are aimed at populations instead of interventions like medications, which are aimed at specific individuals. So if you want to wrap your head around what this public health approach concept is, you can think about what you're seeing right now in the news. So another example specific to autism is embedding developmental and autism screening within pediatric care, so that autism screening is delivered to the majority of children in the nation, and we can hopefully lower the age of diagnosis and lower the age of first services. I think where we start to have difficulty is when we reach this transition age population and into adulthood. As Dr. Spitalnik referred to earlier, we lose entitlement programs, we lose mandated programs, so that when people are leaving special education and moving forward past that age of special education, it's harder for us to deliver population health approaches because we don't have these structures in which to embed them. So a public health approach offers us a framework to try to understand the causes of problems, and ultimately to try to prevent the negative consequences so that people can reach their full potential to the maximum extent possible. So we want to understand what is the problem that people are facing, what are the causes of these problems, what works and for whom they work to solve problems. And then we want to know, do the policies and programs that we create help to alleviate problems? And when I talk about problems, that might refer to not receiving quality transition planning, or not finding a job, or not having the supports that someone needs to complete post-secondary education. Whatever the person's goals are, that's the type of, quote, problem that we're looking at with this approach at the population level. So taking problem solving a step further, what we do is analyze data about populations using a health services research approach. And when we conduct research and we think about the types of things that we're going to study, we try to keep them very grounded in questions and answers that are really going to help people in their lives. So we want to know, what help do people need versus what do they actually get? And then that gap in the orange box, what are the unmet needs that we're not addressing? And then we want to know, how does life turn out across our domains like employment, community inclusion, post-secondary education? So what we do is essentially needs assessment using national data. And the statistics that we come up with are very important in terms of drawing attention to problems and pushing policy forward. But each of these questions have to be considered within context. Context includes, what are the opportunities of people within their community for things like employment? What are the transportation options? What is the economic status of the community and availability of resources? And even, what is the will of the community to pitch in and solve problems? These are all important things to consider in the context of what people need versus what they're receiving. So let's switch course for a minute and go back to our why questions. This is Miguel, and Miguel has been in high school for 5 years. He wakes up one morning and he goes to school for the last time. And the next day is graduation day. Miguel accomplished a major milestone by making it through high school. And for parents of younger children, it can be tough to imagine that you will ever get to this day. We spend so much of our focus on simply getting to this particular point. But Miguel wakes up the next morning and his skills and abilities are no different than they were the day of his graduation. But his relationship with organizations, with society and social institutions is fundamentally different because now he has to qualify for and count on an entirely different set of services and supports. And he has an entirely different role. He is no longer a student with a set of services in place to support him. And his support team may or may not have done a great job preparing Miguel and his family for this day. So why is that? Why don't we know how to best help Miguel? I'll share a couple possible reasons. The first is that the story is not just about Miguel, it's about what surrounds him in his community. And we're not great at measuring opportunities and resources in our communities or determining where the breakdowns are. So a public health approach to autism is appropriate for addressing the needs of folks on the spectrum because the strengths and challenges of people on the spectrum are based on the interactions across different levels of their life. So between biology and genes, environments that they live in, their families, the community, school and work, and society. The person is part of this ecological system. The second reason that it's hard for us to know how to help Miguel is that the life course is about having connections that support us and help us find the things that we need. And we're getting a little better at measuring our social networks and making sure that connections that you need are in your network. But in the field of autism and developmental disabilities, this concept of social networks and how to measure them is still a bit of a foreign concept in the literature. And third, another thing is that life course is about systems. And it's incredible the number of systems families have to interact with to get the help that they need. So while anyone listening today can probably tell you a story about how fragmented and broken our systems are, there's not enough work being done to figure out how to create seamless, interconnected, coordinated systems that share funding to support a person. So these are just some ideas about why transition questions have still not adequately been answered today. So fundamentally, we believe that a significant part of the problem is that most autism research is focused at the person level. And it's asking questions like, how do we build a person's skills? How does a person respond to a particular intervention? And these are great questions, but they are not focused on life course, networks, systems, or context. So am I saying that studying individual level interventions is a quote bad thing? No, absolutely not. But there are a couple problems if our research knowledge mostly comes from that person level. So first, we often test things with the people who are easiest to conduct research with. So we actually know the least about the people with the greatest needs, and that's a problem. Second, and oftentimes studies are only conducted on a handful of people. So what we learn from these studies only applies to a handful of people. We don't have many larger solutions for bigger groups of people. And then third, the spectrum is really vast, but our solutions are small in comparison. So most importantly, what any parent can tell you is that even when we have answers to the clinical intervention questions about what works with whom, the barriers to accessing what people need can be insurmountable. So to reiterate, it's not that intervention research is not important, it is, but what we need is balance across the types of research that we are conducting. Because at the end of the day, what Miguel needs is connections to opportunities and systems that are easy to understand and access and effective in what they provide. And doing more of the same, continuing to focus at the person level, isn't likely to result in success at the population level or to move the needle on outcomes. If we do not continue to address the bigger picture, we're just not going to make the amount of progress that is needed across our nation. So in reality, life course thinking applies to all lives. So why are we focused on autism? The answer is that there are some things we have identified that are unique about folks on the spectrum. First, their outcomes generally are worse than peers with other disability types. Second, they have higher rates of co-occurring health and mental health conditions. They also experience more early disconnections, so delays in connecting to work or continued education. And they experience health disparities, meaning that outcomes are not equitable across people with autism, partly due to structural racism within how systems are designed. So these are critical problems to understand and solve, and we won't get very far if we don't address problems like disconnection from services. I think we can all agree on that. Okay, so let's talk about what we've learned over the past 5 years or so. There's an old policy saying that special populations don't count until someone counts them. So somewhere in the neighborhood of $15 billion per year are spent on special education services for children on the autism spectrum. And we have few ways of collecting information about the effects of these efforts, unfortunately. So if no one is counting, then we essentially don't know whether things are improving or whether the needle is moving. And in today's reality, you understand this because we understand that if cases of COVID aren't being counted in our communities, we don't really have a great idea of what's going on in the bigger picture. So this is one of the first problems that we noticed, this huge lack of basic information about what happens to folks with autism when they're reaching adulthood. And to address this, one of the first things we did was to start a national autism data center. So we set about producing a national autism indicators report as a vehicle for communicating foundational level statistics about transition age youth and young adults. And this report presented basic information about how adults with autism are faring in regard to employment, education, living arrangements, safety, and so forth. And we used the National Longitudinal Transition Study, also called the NLTS-2. This was a survey administered to youth who received special education during high school and or their parents, and they followed these youth into early adulthood. So to be clear, the statistics I'm going to share with you do not come from surveys that we actually conducted. These are surveys that the federal government sponsors, and then we analyze the data from these surveys, looking specifically at how did students on autism fare. So what we first found was that about 4 in 10 youth with autism did not go to work or continue their education in the first 6 or so years after high school. And this rate of disconnection is higher for youth with autism than it is for youth with other types of disabilities. And then of those 4 who were disconnected, 25% did not have services. So essentially they had nothing to do and no help. And this is the group that really concerns us the most. We also found that young adults on the spectrum from lower income households or who were Black or Hispanic had a higher rate of disconnection, twice that of those from higher income households. And the disparities that we noticed also concerned us greatly as well. So we set about exploring further across our next reports, and all of these reports are online. You can find them at our Life Course Outcomes website, which is listed on your handout. So don't worry, you can go look up any of this later. But we wanted to understand how agencies like vocational rehabilitation and the Developmental Disability Service System were serving transition age youth and young adults on the spectrum. And this work was not easy. It was genuinely difficult to figure out how services like VR work across states. So what are the similarities and differences, and what types of services do we expect people to receive possibly? And that's what we spent a lot of time doing, was just trying to figure out these systems. And I always think for myself that as a researcher, if it takes me that long to figure it out, it just says a lot about how difficult it is for families to try to figure out what is available and how to access it. So these important initial findings that I just shared are based on data that is actually over 10 years old now. And there was a period of time in which we didn't have much national level data. But the newest data from NLTS 2012 has now finally become available. And it shows us that there have been some shifts in population characteristics across people on the autism spectrum. So quickly, the NLTS 2012 is the latest in this series of national longitudinal transition studies, and it is nationally representative, just like the previous studies. And it examines the experiences of students who were in special education at ages 13 to 17, and examines students in any type of special education, but we're specifically looking at those who are in the autism category of classification. It also allows us to look at students who were not receiving special education under the category of autism, but maybe their parents reported that the student had autism. So possibly they had a medical diagnosis of autism, but they didn't qualify for special education, or maybe they qualified under a category of special education that was different than autism. So we have a bit of a more holistic picture of who these students are. The bottom line is that we can look at high school students compared to those who participated in the NLTS-2 in 2002 at the same age, and we can see what has changed over time for these students. So when we compare, we see significant demographic shifts in this data. The more recent cohort, so that's the box you see on the right, the 2012 survey, is more often white. They're more likely to be receiving safety net benefits like food stamps, and they're more likely to have parents who are less educated. They are less likely to have co-occurring ADHD, and they're more likely to have less severe communication impairments, and they're also more likely to be able to converse with little trouble. Another set of newer data that we have is the 2016 data from the National Survey of Children's Health. So this was looking at ages 12 to 17. And this graph shows youth with autism, but it shows high rates of co-occurring mental health conditions among these teens, with 86% having at least one co-occurring mental health condition. So rates of health and mental health conditions are higher across the board among those with autism compared to people with other types of special health care needs. So in summary about this newer data, over the past 10 to 20 years, what we see is that youth with autism overall are less severe in their impairment levels, but they're more likely to come from disadvantaged households, and they are just as likely to have co-occurring mental health conditions as we've seen in our previous data. And CDC data also suggests that the level of co-occurring intellectual disability among these youth has also gone down somewhat. And it's possible that these changes are due to improvements in diagnosis, that perhaps we're capturing a broader range of cases of youth with autism. They do present some challenges though in terms of programming, because we're actually seeing more in the data exactly how wide the spectrum is of autism that we're trying to address. So our more recent work focuses on understanding low-income families. And our newly released 2018 report focused on teens with autism using both of the major national surveys that we just discussed, the NLTS 2012 and the 2016 National Survey of Children's Health. And our 2018 report focused on how the impact of autism is not felt equally across families. So we found that almost half of the population of youth with autism were in low-income households. That means below 185% of the poverty level, which is often the eligibility level for food stamps in states. 1 in 4 teens with autism live in homes that receive financial assistance, compared to 1 in 5 teens in the general population. So if 1 in 4 teens live in households that are below the federal poverty level, and as Deborah said earlier, approximately 100,000 youth with autism turn 18 each year, then that means about 25,000 autistic youth are entering adulthood each year and are doing so with the extra difficulties that come with being in deep poverty. In 2016, the federal poverty level was $24,300 for a household of 4 in the continental US. So you can imagine being a single parent of 3 children, 1 with autism, and trying to raise your family on this income. A life course perspective tells us that what happens early on influences what happens down the road. And if you encounter problems early, then these burdens tend to accumulate over time. And I mean, when I'm talking about burdens, I mean financial burden. Autism is expensive, and higher out-of-pocket expenditures occur even if you are poor for health care and for trying to work. So transportation is also challenging. Being able to work as a parent can be challenging. So rates of poverty and financial burden by the teen years might show us that this has been cumulative across the lifetime of this child with autism. Poverty and disability can be mutually reinforcing. So we sometimes refer to this as the, quote, disability poverty nexus. Let me try to explain that term a little bit further. So teens with autism from the lowest income households were the most likely to have unmet healthcare needs. And we know that being poor increases your risk for having poor health. So having a disability also increases your risk for having poor health. It goes both directions. And what does that mean for youth with autism? So we know that they're more likely to be disconnected from jobs. And if your health is poor and you're not getting the services that you need, this increases your risk for being poor or for staying poor. And if you have health and mental health issues and you aren't getting the help that you need, then you're less likely to be able to keep a job. So two families who have youth with autism can have the same challenges of levels of impairment, but it's different how that impact might be felt based on what their community is like, what resources they have, what their finances are like. So some families are more vulnerable, but we rarely hear about this. And I think it's super important for us to think about this right now, given the economic status of our nation and what we might be facing over the next year or so. It's just so important to be aware that some families are going to be experiencing a hugely increased rate of challenges financially, and in addition to what they already were dealing with. So the other thing we have learned is that minority teens are also worse off. African American teens with autism had the highest rate of unmet needs, and we know that services and outcomes are generally worse for these minority youth. So the statistics on financial burden in the 2018 report really caught our attention. And our 2020 National Indicators report, which will be available soon, and this was led by Christy Anderson, will be out in April. And it takes a deeper dive into family financial hardships. So we are focusing on this for real life reasons, because it is hard for families to devote attention to finding interventions and planning for transition when just meeting basic daily needs is a struggle. Many families of children with autism end up with this terrible dilemma where there's only enough money to put food on the table all month or to give their child needed services. So in this new report, we looked at hardships among families of children with autism, and we compared those to children with other types of special health care needs and those with no special health care needs. About 30% of children with autism lived in very low-income households, below 100% of the federal poverty level, compared to 25% of children with special health care needs and 20% of children with no special needs. We also found that 46% of children with autism were publicly insured, compared to 29% of those without special health care needs. So again, you can see that level of financial burden is higher among the autism group. Now, there was some good news. Nearly half of families of children with autism had no out-of-pocket medical costs. And we think that public insurance is playing a huge role in mitigating cost for these families. So there's some data, again, that's really important for policymaking, for advocacy, to make sure that families have access to the safety net supports that they need so desperately. Material hardship was common among families with autism. And this is defined as difficulty paying bills. Parents may have to stop working to care for their child. And we see disparities here too, where 75 to 80% of Black and Hispanic families reported at least one material hardship. Material hardship was also more common among families of children with autism compared to children with special health care needs and those with no special health care needs. And for example, parents of children with autism were more likely to have to reduce or stop work. But we also found that these families are less likely to be disconnected from public benefits. So among low-income households, those with a person with autism were more likely to use every type of safety net program. So free and reduced lunch, SNAP or food stamps, cash assistance, WIC among younger families. These benefits appear really powerful for these families. Okay, so what do we know so far about this newer cohort of youth with autism? We know that they look a little bit different from earlier cohorts. We know that they have more financial burden, but let's switch to talking about what kinds of services these students receive. The main focus of my research has been employment for people with autism, and we know that about half of youth with autism will have at least one job between high school and their early 20s. And we know that about 2/3 of youth who apply for assistance from VR with getting a job will actually receive VR services, and about 2/3 of these will become employed. So one takeaway is that employment definitely is possible, and our services that are out there do have some success. But since the passage of the Workforce Innovation and Opportunity Act, WIOA or WIOA, people refer to it differently, that passed in 2014, and that's our federal legislation that governs VR and workforce development. Since that has passed, the focus of vocational interventions has shifted more to looking at what happens during high school. It used to be that students typically weren't involved with VR services and sometimes didn't even have contact with VR until after high school. But this has been slowly changing, and I'm going to share some findings with you from our latest studies on this topic about VR for students. And first, we're going to talk about transition too. So let's think about transition planning. If you're interested in working after high school, as the majority of students with autism are, then you should have a transition plan that supports transition from school to work. And that is true for all students receiving special education at this age. They should have a transition plan. It's part of our federal law. We know that about 7 in 10 youth with autism receive special education services at some point during high school. And others may not have qualified or may not have received special education under a classification other than autism. But if we think just about this 70% of youth in special ed, of those, 55% of teens with autism ages 16 to 18 experienced transition planning. In nearly half of cases, parents said that the plan was mostly created by the school. So what this means is that still far too students with autism are receiving transition planning, and then we have some hints that probably far too few family members and students themselves are actually involved and invested in creating these plans. So we know that the strongest predictor of future employment as adults is employment during high school. And the concern is that work might be less likely to occur if students are not receiving transition planning. So there's also concern that parents and educators may not view students on the autism spectrum as capable of work. So we conducted a study to look at the types of work experiences that students on the spectrum were actually having. You hear a lot about the importance of community-based paid work experiences and their relationship to later employment, and that is definitely true. They're very, those experiences that are paid work are more associated with work down the road. But we thought that students might be experiencing several types of work at school or in the community, paid or unpaid, and we wanted to understand more what that looks like. So we compared the work experiences of students with autism to those who did not have an IEP and were not in special education. And we found that students with autism were more likely than their peers to engage in school-sponsored work. That's that top bar up there. But they were far less likely to experience any community-based work for pay compared to their peers who were not in special education. And overall, we found that only 4 in 10 high school students with autism at 16 to 19 had any type of work experiences, so paid or unpaid, school or community-based, within the past year. And this rate was lower than students who were not in special education. And when we looked at factors of why these students didn't work or did work, the most important thing was their navigational skills. So how were they able to get around the community? How were they able to use transportation? That's a very strong predictor of high school work experience. So this study tells us that far too few high schoolers with autism are having any work experiences. It also tells us it's vital for students that we build work experiences for students in their own communities, and that it's important to identify collaborative partners to build transportation networks and to provide transportation training. So besides receiving work experiences through school, it is also more common these days for students to receive VR services, as I said earlier. We recently conducted a study that was examining the types of VR supports high school students on the spectrum receive. And specifically, we wanted to know whether they were receiving job-related services, because these services have a good track record of leading to employment. And we also wanted to know whether transition-age youth with autism were receiving post-secondary education services through VR as well. So this is work that will be published soon. And there's, to back up a little bit, there's a whole host of services that a person might receive from VR. But what we were most interested is the job-related services that you see on this slide. So on-the-job supports, supported employment, job search, job placement. These are directly related to work. They're not related to classroom-based training or learning how to write a resume. Those things are important. But if you look at research on different VR services, the services you see on this slide are the ones that are most associated with employment at the time that someone finishes their VR services. And we found that youth who entered VR when they were high school students, so at ages 16 to 19, they were most likely to receive assessment services and VR counseling. About 65 to 70% received those types of services. However, far fewer received actual job-related services. So on this slide, you see that only about 20 to 40% received those types of services. We found that students who received more job-related services were far more likely to be employed at VR exit. So in this graph, we looked at the number of key VR services that these students received, and we looked at how likely they were to achieve employment based on the number of key services they received. So we compared students to those who were non-student youth and to young adults. And if you look at the darker blue bar on the left, that's the student group. And you can see that if they received no key VR services, then only 26% were employed when they left VR. But if they received 2 or more key VR services, about 60 to 80% were employed at VR exit. Now, I'll tell you that if you look at the numbers for those who received 3 of these services or 4 of these services, it's pretty low how many actually received those, but you can look at the effect uphill going from 0 services to 4, and it just tells the story dramatically about how important it is that they're receiving these hands-on job-related services. So in regard to post-secondary education services through VR, we studied youth with autism who were ages 14 to 24 when they entered VR. And we found that they were less likely than students with most other disabilities to receive post-secondary education services. Now that would support people who are attending 2-year college programs, 4-year college programs, but even technical training programs, vocational education in their community. If they did receive these services, then they were more likely to be employed at VR Exit again. So this is work by Jessica Rast on our team, and it's really important because we didn't know much about post-secondary education supports for students with autism through VR prior to publication of the study that Jessica did. Okay, so we're going to shift a little bit here to talking about healthcare transition. This refers to the need to move from pediatric to an adult provider to possibly change health insurance and to prepare to take more responsibility for health care as someone becomes an adult. And providers can assist this transition by helping youth and their families to prepare for these challenges before youth reach the age of 18. We saw earlier that the prevalence of health conditions is higher among children with autism. This slide shows work by Lisa Crone, who uses California's Kaiser Permanente health records, and it shows us that this prevalence of health conditions that are co-occurring with autism is also true for adults, both for physical and for mental health conditions. So while healthcare transition is increasingly recognized as necessary for all youth, it is especially important for those with complex needs like youth on the autism spectrum as they age into adulthood. So we use the National Survey of Children with Special Healthcare Needs to look at healthcare data on healthcare transition for children as they neared adulthood. And what we found is that only 2 in 10 received healthcare transition planning. We also looked to see what is that different for people who have a medical home, and those with a medical home were 3 times as likely to receive healthcare transition services. A medical home is a concept that is described by the American Academy of Pediatrics, and it is an approach to providing comprehensive primary care that facilitates partnerships between patients, clinicians, medical staff, and families. And in a medical home, patients have a personal physician, and they have a centralized medical record and a higher degree of care coordination. So that care coordination aspect is probably really valuable in whether they're receiving healthcare transition services. Another thing we found is that those who received healthcare transition were more likely to come from houses that were above 400% of the federal poverty level. And they tended to be youth with less severe limitations. So that tells us again that our families who are financially disadvantaged and whose youth are facing more significant challenges, those are the ones that we have to really make sure are receiving healthcare transition and talking about what's going to come next with their healthcare as they age. So we looked at specific components of healthcare transition. Only 1/5 of families of children with autism, of those who saw a provider who treats only children, only 1/5 had spoken to their provider about switching to a doctor who treats adults. 3/4 of families of children with autism had worked with their provider to make positive choices about their child's health. That's a great sign. But fewer had spoken to their doctor about healthcare changes that happen at age 18, and even fewer had a written plan to address healthcare goals and needs. We also found that healthcare transition varied by race and ethnicity in children with autism. So generally, Black non-Hispanic children had the highest reported receipt of healthcare transition, but Hispanic children had the lowest. White children were also the least likely to have a written healthcare transition plan. and the least likely to have communication with their provider about changes in healthcare that happen at age 18. So what happens is different across different races and ethnicities. Just a tip for you, if healthcare transition is a topic that is of interest to you, you might go check out a website that's called Got Transition. And there are a lot of resources there about healthcare transition for youth with all types of different disabilities. So this slide is the end of our national level data. And I'd like to switch to talk about some state level data that is specific to New Jersey, because my understanding is most of you that are listening in today are likely from the New Jersey area. A couple years ago, we put together some data for Amy Kratchman, who's one of your former LEND fellows, and she was doing some advocacy work around services in New Jersey, and we looked at what specifically some of this data tells us about New Jersey. Most of the state level data that we have about adults with autism comes from VR, and we have some information from the National Core Indicators data set about DD services, but it's difficult to compare that DD data to national averages, so we tend to focus on some of our VR data. We recently published several studies which analyzed vocational rehab data for transition age youth with autism, and we looked at 4 different things. We wanted to know, how often do youth with autism receive VR services after they're found eligible? How often do youth begin VR services during secondary school? So do they have early reach to services? How often do youth have a timely development of an individual plan for employment? That's important because you have to have that plan developed before you can actually begin services. And how often do youth become employed after they receive VR services? Let me specify that employment for VR refers to competitive integrated employment in the community in which at least more than half of people who are working in that workplace do not have disabilities. So it's not, they don't include sheltered work or non-integrated employment as a successful employment outcome. Let me also preface this information by explaining that not everyone who is found eligible for VR services actually ends up receiving them. So for a very wide variety of reasons that we can talk about later if you like, not everyone gets them. So that said, of youth who are eligible to receive VR services in New Jersey, 51% received them versus 68% nationally. And then 10% in New Jersey began services during secondary school compared to 50% nationally. So I believe, if I'm recalling correctly, New Jersey was below 2 standard deviations in how many youth began early services during the high school years. On a better note, more youth from New Jersey who received VR were employed at the time of VR exit compared to national averages, and more youth had an employment plan that was developed in a timely manner so that they could quickly begin services. So some nice things that we see in that VR data. We recently analyzed state plans for implementing WIOA, and we looked to see how states were addressing the VR needs of people with autism. So every state has an employment plan that talks about how they're going to implement VR services, and they also identify groups in their state that are, quote, underserved by VR. So about 37% of states overall identified autism as a group that was underserved in their state, based on the results of a VR comprehensive statewide needs assessment. Compared to other state plans, New Jersey's plan contained few references to autism and did not identify autism as an underserved group. So let's talk about, and actually there's one more quote that was in the New Jersey state plan. It said that while many high schools take advantage of the VR counselor's expertise in vocational rehab and presumably invite them to attend transition planning at that IEP meeting, others prefer not to include DVRS on a regular basis. So if we think about that New Jersey data and what it might mean, there's a couple recommendations that come to mind. The first would be to improve the overall percentages of youth with autism who are receiving VR services, and especially those who begin those services early during high school. You'll hear me say that over and over. Earlier is better. The next thing would be to improve how autism is addressed in the next state WIOA plan. Now, those plans were supposed to come out in 2020. They'll come out again in 2024, and there'll also be an opportunity to modify those plans in 2022. So that occurs on a regular basis. There are opportunities for public to give input, for providers to give input, to review that plan and make sure that it's really addressing the needs that you see on the ground. And the final thing would be to improve interagency coordination between local education agencies and VR so that high schools are routinely involving VR in special education transition planning for students who have a goal of going on to employment or to post-secondary education. So in regard to the state of science that we talked about today, we talked about national level statistics and state level for New Jersey, and the take-home points were that there is a big services cliff, frequent disconnection from services. We know that where you live matters, that your socioeconomic position and geographic location matters. We know that almost half of youth with autism are living in low-income households. We talked about that poverty and disability is really a two-way street, and that service access and outcomes are generally worse for minority youth. So that tells you, this slide tells you a lot about where the targets are, like, you know, where program development and grant writing would be particularly fruitful for some of these populations that are particularly at risk of poorer outcomes. We also have a goal of expanding the age range of our investigation. This is an important point because we have almost no national level data about adults with autism who are older than age 25. So we have the National Longitudinal Transition Study, which looks at people coming out of special education. But in the past, that has only followed students forward until they were 21 to 25 years of age. And our latest data in NLTS 2012 is really limited towards those 13 to 17-year-olds. We don't have any more recent data about these students as they enter adulthood. And so there's just so much that remains to be learned. So I'd like to switch now to talking more about what we are currently doing to address this problem. And we're going to begin with an overview of our Transition Pathways initiatives at Drexel. So most young adults on the autism spectrum do not transition successfully from high school into employment or post-secondary education or community participation without some degree of assistance. And as I mentioned earlier, work experiences during high school seem to be associated with better employment outcomes during adulthood. Okay, so a little history. You might have heard of Project Search. Project Search is a one-year school-to-work transition program for young people with autism and/or intellectual disabilities. And it takes place in the last year of high school at ages 18 to 21. So it is a vocational program that has a goal of competitive employment, and interns are immersed in a workplace. They experience rotations that focus on career exploration or job skills acquisition. They receive customized job search assistance, and then there are set up business advisory councils that assist with job development. So that's the standard for Project Search, which has been in operation since 1996, and it has expanded to sites across the country. So that's why you're more likely possibly to have heard of this program. But implementers noticed that the program needed some adaptations to be more successful for students on the spectrum. So There's a new set of programs, newer, called Project Search Plus ASD, and it uses special techniques. So it's more focused on social communication intervention, providing visual cues, supports for behavior and self-regulation. It may have staff that are actually trained in ABA principles, and it addresses generalization across settings, which we know is particularly challenging for students on the spectrum. So we applied this learning and we innovated a transition pathways initiative at the local level in Philly. And this is a set of programs that is directed by Diane Malley. Some of you may know Diane because she used to be the director of your parent transition center, I believe, for the New Jersey area. So this program is a collection of innovative and collaborative efforts to improve outcomes for young adults on the spectrum. And this initiative builds upon Drexel's founding principle of inclusion by demonstrating that what it takes to make the world a more welcoming place for people on the autism spectrum. And the Transition Pathways Initiative focuses on making changes at the systems level. And it's implemented through autism-specific programs that build capacity within our partner organizations. So we're going to talk a little bit more next about what that looks like. So we began by starting a Project Search site at Drexel using the Project Search plus ASD approach. And the students come to campus at Drexel and we provide transportation training to get them to campus and to their internship sites. And a typical cohort of students is about 8 students with autism and/or intellectual disabilities. There is a certified instructor and job coaches, and students rotate through unpaid community-based internships with continual feedback about their work. And what they're learning is entry-level transferable work skills. And the outcome then is employment in the community. So I'd like to share a video clip about this program. I think we're ready to go ahead and start that.
At Drexel University, we are hosting Project Search this year. It's the first year it's going to be here at Drexel University, and it's a really wonderful collaboration across a number of organizations. So OER, IDS, Drexel University, a job coach organization called CIS, and then the School District of Philadelphia.
This Project Search is unique because the individuals that are participating in this program are individuals who have autism and/or intellectual disability. We want to highlight these individuals and show that they too can work and contribute to society.
I just got into my internship like a month ago.
So what's your internship? What do you do?
I do Dragon Card. I do swiping cards, filing out the paperwork, putting stuff in order, all that. I may have more internships by the time the end of the year comes.
While they're here, they're getting specific job training to one of the 8 different internship sites that are around campus, such as working in the Dragon Card office, working in the bookstore, working in housing. And the job coaches and other clinicians like myself go out and help support the interns as they acquire the skills necessary to be successful at those internship sites.
We get a lot of support from Drexel. I was telling Jessica that to have a behavior specialist in my classroom taking data, implementing behavior plans is more than I ever imagined. So I'm very, very happy with that, very pleased.
The goal is that these various job skills that they're going to acquire are going to allow them to have a job when they enter, adult life, so to speak, next year. And what's really great is that some of these organizations are actually going to follow the intern as they move into these jobs next year. So they have guaranteed job coaching that's going to happen next year as well.
This is working out real well. Yes.
What kind of things are you learning?
Like, practice job applications, learn how to get along with others, staying calm when people get frustrated. Yes.
While I'm in the classroom, the goal is to teach them lessons such as interviewing skills, resume skills, greeting your supervisor versus greeting a friend. So a lot of soft skills that they would need to know at their job sites.
They're learning independence. These young men and women are having the ability to travel. Some of them have never traveled before on their own. They're learning the world of work. They are learning how to speak with their coworkers, how to speak with their boss. They're learning that they have a huge support system. They're learning responsibility. They're learning those soft skills that you need for work. And they're getting to learn how it feels to have certain expectations and being able to accomplish those.
One thing we know about when kids exit high school is there's what we call a service cliff. So once you leave high school, you don't have access to as many services. So Project Search is an effort to, pile on all that job training and wonderful job coaching before you really exit into the real world, and you're not receiving services from your school anymore.
Seeing what the students are learning, how excited they are about going to their sites, and how excited they are about all these things that they've been learning, I think is what keeps us going even more and inspires us.
The students make it very easy for us to make that commitment because we're getting ready to show what they can do when great minds come together and work together for a positive outcome.
Brought to you by the Pennsylvania Department of Labor and Industry, Office of Vocational Rehabilitation. Contact OVR at 800-442-6351 or ovrfeedback@pa.gov. Learn more about OVR at www.
Okay. So one important aspect of our program is partnership. And you see on this slide all of the partners that are involved in the Project Search plus ASD program, the video that you just watched. We defined who the partner organizations should be, and we brought them to the table. This is actually a prerequisite for establishing a Project Search site. There has to be a commitment to collaboration by partner organizations. So these agencies were used to operating separately from each other in quote silos, and our goal was to establish collaboration. This drive toward partnership is really, it's nothing new. Back in 2002, so nearly 20 years ago, the Institute of Medicine's Future of Public Health in the 21st Century document called for a significant movement in building a new generation of intersectoral partnerships that draw on the perspectives and resources of diverse communities and actively engage them in health action. So our partnership adventure turned out to be a vital step. It was a huge investment of time, it still is, but it is these partnerships that have driven our success to date. So if there's nothing else that you take away from this portion of the talk, I want you to remember about collaborations and partnership. So one sometimes challenging aspect of partnership is funding the program. It is difficult for one organization to raise enough funds to support a vocational program alone. Our use of braided funding, which is pooled agency funding, is a feature of many successful transition initiatives, such as other Project Search plus ASD programs around the country, and another program you'll hear me talk about in a minute, the Maryland Seamless Transition Collaborative. In braided funding, the money and the budgets stay with the organization. So multiple funding streams are used to pay for specific staff, for services, and for supports. But these expenditures are tracked and reported separately by each partner organization. So for example, in Philadelphia, the school district contributes a teacher and 2 paraprofessionals and a transition coordinator, but VR might contribute different folks, and then community service agencies also contribute job support coaches. In some cases, money does, quote, follow the person. So for example, in the case of VR, those VR funds are person-based dollars. Medicaid funding would work the same way, and workforce dollars also work that way. But when we're talking about braided funding, that is tied to organizations. There's another concept called blended funding, which is very similar to braided funding, but in that instance, the money is all combined and pooled, and organizations don't continue to track those funds separately. So if you're interested in that, there's a lot of information online about braided funding and how that can be accomplished, but it's been super important, again, to success of our program. So we'll start our third cohort of Project Search interns this fall, and pictured here is part of our first cohort. These are former Project Search interns who were hires at the Philadelphia International Airport. Members of the Project Search Business Advisory Council from the Philly International Airport recruited these individuals for full-time employment in various departments. And this group was part of our City as a Model Employer initiative. And these interns now work as employees in administrative services, in payroll and transactions, in the aviation department warehouse, and in human resources. So they're new hires. They work an average of 37.5 hours a week. So they're working full time, earning $12 an hour. They travel independently to work, and they're now civil servants that have benefits. So this has been a huge success. And part of it, I think the success of this program has been that we also conducted inclusive workforce training for 55 employees at the airport. And have developed multiple collaborations like this with the City of Philadelphia. Okay. So 3 years down the road from the launch of Project Search, we launched another Transition Pathways initiative called Project Career Launch. And this project uses a framework that was modeled on the Learning Academy from the University of South Florida. Our program is adapted from theirs. So the Learning Academy is a post-high school program, and ours is again targeted to youth who are in their last year of high school. And it features a curriculum. It uses college students as peer mentors, and it provides an internship. And the goal is that students leave with a career plan that is focused on employment, and we provide a connection to further training or post-secondary education if it's appropriate. Most go on to employment after the program. But I will point out that this is a program that does not involve remedial academic work. On the other hand, people may receive a certificate in food handling or such if this is part of their training, but it's not primarily focused on academics. And we're gonna watch a video that describes Project Career Launch.
2, 3.
Some people, they see people with a disability and they feel like, oh, you know, maybe they can't do much or anything like that. But you have to give everybody a chance. And this program has done that.
Project Career Launch is a transition program in collaboration with the School District of Philadelphia and Community Integrated Services led by Transition Pathways. And it is a transition program for young adults on the autism spectrum for career-focused employment.
It's amazing because it improves the post-secondary outcomes for so many students.
And our classroom is the community.
I didn't know how to start out with a job.
Any job sites to refer to, any websites I could look up for more information. I felt like I didn't have any of that before coming to Project Career Launch.
Well, we've also all learned about self-advocacy.
Self-advocacy means that you don't have to hold your voice in. You should be heard and speak what you mean. Because I never really did. I would just be quiet.
I remember just going through school and just going through normal daily life at home, just completely passive. But being here at Project Career Launch has kind of restored some of that.
what I'm looking forward to in the future is to find a culinary field, like working in a kitchen. I really do want to have employment of landscaping. I'm looking forward to making a living for myself.
Working with others, kind of part of why I have an interest in human services.
My career goal is to become a character artist.
Okay. And finally, we're also involved in a newer program called Year Up. And this is a program for low-income youth that provides 2 years of post-secondary education training plus 6 months of training in a Fortune 500 company. Year Up, again, does not prep kids to go to college, but is instead focused on transferable skills for work. These are youth who often have additional challenges of learning gaps and financial disadvantage. And I want to point out that these programs are really filling a gap because in the Philadelphia area, it is difficult to connect youth to VR and to employment support. So we're using oftentimes workforce dollars to connect youth to these internships. I'm going to talk a little bit about the successes and challenges that we've had with these types of programs. So in terms of successes, we first developed an early framework for partnership through Project Search. And we're building on these successes by expanding to develop new models and other school to work programs within the School District of Philadelphia. The second success is that the School District of Philadelphia, community agencies, and the university are really committed to implementing vocational programming, and they basically will continue until they pull this off. So that has been just such a positive experience. And third, our commitment to success has really driven our success. We have chosen to not wait around for funding, but if we have an idea, we will also often start a project before we even have secured the funds to pay for an internship. And in most cases, the funding has come along eventually. Fourth, by engaging a large school district, there has been a ripple effect. We launched Project Search. And then the School District of Philadelphia decided to start their own Project Search site. So we now have 2 sites, and we have 2 sites for Project Career Launch for next year. So we went from struggling to fill 8 Project Search plus ASD spots to having over 100 applicants for the programs. It took a while to get the word out. It took a lot of persistence and establishing trust across partners, but it has really been remarkable how it has grown. Last, the success of the Transition Pathways Initiative has shifted business as usual in the school district. So teachers are now understanding better what is needed for a successful school to work transition program, and they're essentially back mapping what skills the students need when they get to the school to work transition program, and they're teaching those skills earlier. So that partnership has been super instructive in that area. And of course, this work does not come without challenges. So the work is constant and dynamic. The funding system has been unstable and inadequate. VR in Pennsylvania has had to go to what they call an order of selection. An order of selection is a policy basically in a state that says who is prioritized to receive VR services if the state doesn't have enough funds. Many states operates on orders of selection. So what that means is that for Project Search, VR will provide funding through the school year, but once that student leaves school, the funding is then often gone. So since youth with autism don't always fit typical disability criteria, they often don't qualify for VR, and they end up having some gaps in services. Students may be moving into jobs after high school without the state then to have funds for supports in that job. In Pennsylvania, it takes a couple years to get through the system and to get into Medicaid funding, for example, if someone needs long-term supports. From what I hear, it's very different from what it's like in New Jersey. Another challenge is that most businesses are risk adverse. They need grants to supplement people to encourage early adoption of programs like this. And we often have to fight stereotypes about the ability of youth on the spectrum to work, to convince people that, yes, there are many strengths and things that people bring to the job, and employment can be very successful. Sixth, autism is one barrier, but deep poverty creates new issues. So, for example, several of our interns have had issues with bed bugs in their in their households, or things like that, that we've had to come up with funds to remediate those challenges so that they could return to the program and to their jobs. And last, another challenge is delivery of things like school lunches when people are at off-site programs. So program execution often involves nitty-gritty problem solving that takes a lot of time, but with success, it's been just highly worth it. So several lessons have emerged from our work thus far. The first is to start small with what's feasible and build momentum. The second is that some of our learning has occurred through what we would call improvement science, instead of focusing solely on implementing evidence-based practices, because there just simply are so few evidence-based practices. This looks more like doing data collection about implementation and really learning from what we're doing and carrying that forward. We've also had a focus on partnership and identifying what we call spillover effects. So starting something and then it rolling over into development of new programs in the community. Those are important types of things to track as you go. Third, we often face challenges from other groups out there in the marketplace who are also trying to place youth and adults with autism into jobs. The challenge is that sometimes these organizations are de-risking hiring by kind of saying, I've got the solution and we'll handle everything. You don't need to risk failure as an employer. And this fills a void of doing something about neurodiversity, but without really doing anything, because it doesn't build capacity within the workplace. It doesn't focus on providing training to employers and really, building their confidence about employing people who are on the spectrum. So that's just another reality. Oops. Okay. I want to share too, not just about our program, but about other programs that are having some experiences that are ones that I think are worth noting. So the Maryland Seamless Transition Collaborative, which is often referred to as MYSTIC, is one example. And this is a 3-year program that is delivered in grades 10 to 12, or during the last 3 years of our certificate program. It's not autism specific, but it does include students who are on the spectrum, and it focuses on the 7 components of programming that you see here on this slide. MYSTIC provides intensive technical assistance to their collaborators via monthly meetings and in-person trainings and what they call just-in-time supports. They have quarterly meetings across sites, and a local site coordinator meets with a technical assistance liaison. So again, this program, like ours, focuses a lot on collaboration, and they also attribute, I think, their success to beginning early again, 2 years before exiting school, and then making sure that families are understanding the system and that those students have linkages to adult services when they leave that program. So that's one that you might go look up because it is close to you. Another state to look at services for is Texas. Texas has done a great job and has really come forth as a model state in how they're thinking about autism services. So Texas hired a state program specialist who is a board certified behavior analyst. And this person has been really overhauling training and services specific to autism. She's built an extensive training infrastructure, and they've also redone how they're providing payments to community rehabilitation providers who provide services for those with autism. They've built in these premiums that people, to encourage people to take on more complicated cases that previously might have just been deemed people who were unemployable. They've built in those incentives, but they've also required that you have to have an autism specialization certificate from the University of North Texas. Now that involves online training, but what they're trying to do is to build in some standards so that people who are serving as, quote, autism specialists are people who have actually had some training, and then perhaps those providers are people who specialize in having folks with autism on their caseload. So they're trying to build, find creative ways to build overall competency. I want to highlight just a couple other states. So when we looked at state employment plans, there were a couple that stood out as providing exemplary services. Virginia was one with a comprehensive service model that involved technical assistance, supported employment, community support services, and therapeutic behavior services. You might also go look at Delaware's Pathways program. They looked at ways to extend long-term vocational services after people left VR but still needed assistance. Kentucky has done an exemplary job of building business teams and really finding ways to have opportunities available in the community for people to walk into. And then Texas, like we said, with use of autism experts and specialized staff and standards of practice. So there are things out there that are working that we can start to point to. They may not exist in every state, but I think there's a lot of innovations going on right now that we can learn from in communities. And if you want to read more about what different states are doing, if you go on our website and you search on employment policy and autism, you can find the article that these came from, and then you can find a breakdown of what each state is doing. And I think that resource is also listed on your handout as well. Okay, so I don't want to leave this topic of what we have learned about school to work transition without mentioning the challenges of providing transition services in 2020. So I'm acknowledging just the fluidity of the situation with service delivery and the current complications. And we have provided a resource handout that also contains resources about COVID-19. You can look for resources on the Bog Center website. And then there are several other resources locally that might be helpful to you. One is Autism New Jersey. Another is the Autism Family Services of New Jersey, which is part of the Family Resource Network. And then there's a website called My Goal Autism, which might also be helpful. The Rutgers Adult Autism Services Program has also launched a new telehealth program for people who use their services, but they also have some resources that are available online that might be helpful. So they're refocusing on teaching and maintaining vocational and life skills through telehealth. They're also providing supports for people for maintaining routines and schedules, which we know is so important for stability. And then finally, the Federal Interagency Autism Coordinating Committee, the IACC, is now regularly updating their autism-related coronavirus resources as well on their website. And I expect that we'll see additional guidance emerging daily as this goes on about how to provide services and help people maintain stability. Okay. Finally, I just want to return to this topic of population health, and we're getting towards the end of our presentation here, and we'll go into questions and answers soon. So if we look at this quote, that the ultimate purpose of population health policy is to improve the health of individuals and populations by investing in the determinants of health through policies and interventions that affect these determinants. This means that we can make improvement in employment for people with disabilities and other areas of their lives, But until we start investing in solutions for inequality and remediating poverty, it will be difficult to make strong progress. So this is a really important consideration for moving forward. And if this topic interests you, I would point you to the approach that the California Children's Trust is taking to foster a collective approach to improving children's mental health and their well-being. It's really a great example of systems change and how to harness like the will of the community and funding that is present in the community to get at some of these underlying issues, which are just often so difficult to remediate. Okay. And then last, much of our work to date has focused on examining these social determinants of health and employment at the national level, but our work at the state level has also revealed huge differences across states in delivery of services and in outcomes for employment indicators in particular. But we often ask, what is the best geographical unit for collecting data to generate action? And it really is at the local level. So this is the level at which you can best tailor interventions, develop solutions that are geared to what you need in your community, and collect data that is specific to your community and your community context. We also have been able to map individual level outcomes and data on the service system at the local level. And we can use techniques like eco-mapping of the service providers in that area to see where they're located and where there are gaps in services. So if this is kind of work is of interest to you, the world needs you, and there's so much to be done at the local level. So I really encourage you to pursue that. So next we'll be opening up for questions, and I encourage you to stick around for QA and to complete an evaluation form. You are also welcome to contact me with questions. This is my email address. There is a handout available online today, like we said, with all the slides and the resources. And with that, I will hand our virtual mic back over to Dr. Spitalnik.
And thank you so much for this wonderful presentation. And I want to start with a couple of questions at a different levels. You've talked about working at the local level. You've given us a lot of insight about working at the population level and some examples. But would you be able to give us a short framework for some principles that you would have us think about that would be best practices for transition?
Sure. So at its heart, there is no one set of best practices that is agreed upon for transition, but there are definitely some key points that have emerged across the years. And I think the most important of those is that earlier is better. So there's at least one study that has found that better employment outcomes occur for those who receive transition planning that starts at age 14 instead of age 16. And I think I understand that New Jersey allows for transition planning beginning at age 14. So that is a definite advantage that people should take advantage of. The other thought is that, transition ideally begins at birth. And if you go hunting around online, you can find some resources that talk about transition across the years. And so it's important to think about things that you can do from very early on and across the school years to make connections in the community, to build social networks. And, those are the kinds of things that we can be working on at home these days while we can't get out so much, but there are skills that definitely build upon each other. And that's part of that life course perspective, is thinking about skills that you build early on, how those accumulate across the lifespan, and then lead to hopefully employment or whatever that person's goals are as they enter adulthood. Another idea is just this concept that hands-on work-based learning in the community is preferable to classroom-based learning. Both are important, but we know that especially because generalization of skills can be more difficult in people with autism, it's really important to be out there in the community and have these work-based learning experiences. That's also true because it's easier to individualize learning when you're out there in the community and not so much in a group. And students with autism may have very specific interests and strengths that are outside the box that need to be considered. I would also say that families are key. Students are key. We need to encourage involvement of both, but I'm a strong proponent of this idea that the goal is not necessarily to be independent, but it's to be interdependent. None of us function on our own or live completely independently. We need to have connections. And for families, this linkage to adult providers and building competency in families so that they know how to seek out resources is just, it's so vital. We also have to think about transportation, building transportation skills, and really, finding some safe ways for families to do that they feel comfortable with. We need to think about expanding social networks. That's an important part of transition practices. And we need to make sure that goals are tied to services that address those goals. So it's great, to say in a transition plan that you want to work on employment. There really needs to be a very specific, thought out, action-oriented plan for how that's going to happen. And there's two places I would refer people to if you want to, read more. The National Technical Assistance Center on Transition is a great resource. There's another website called transitioncoalition.org, and those are great places to go look to see what is research-based evidence, what are evidence-based practices, and then what are things that might not have a whole really strong research-based evidence behind them, but they appear to be promising practices that are things that we might want to pay attention to.
Thank you so much for that. And while I'm asking, we have a few more questions, but also to remind the audience that the question box, that they can type questions into the question box. Having appreciated the framework you just laid out, I want to turn to some of the data you presented. We have a question about the outcomes data, and it was in reference to the statistic of 4 in 10 young adults with autism are disconnected. Can you tell us anything about the experience of the 6 out of 10 who might be connected? Does that refer to day programs, employment, self-direction? Do we know anything about their experience from your data?
That is such a great question. When I talk to reporters, this is one thing that consistently comes up as such a challenge to answer questions like this. If we think about what's going on at a national level, we really can only turn to our national level surveys to help us learn about these things. And when it comes to survey analysis, you only know how the question was asked. So in regard to looking at connection and employment, what we know is whether someone had a job within a specific time frame. So we might be able to look at, did they have a job within the last 2 years, or have they had a job since they left high school? And in this case, we know about employment that people who were connected, so that 6 in 10, had at least one job over that period of early years from leaving high school to when they were in their early 20s. But we don't know as much about what those jobs looked like, and were they community-based or not community-based. The National Core Indicators data set from DD can tell us a little bit more about that. And there are some articles, some research out there that has looked at whether people are going into community-based employment versus non-community-based or more sheltered employment. So that is the best I can answer that, unfortunately, and it is really frustrating that we don't know more. And these are the types of things that we're trying to learn more about.
Well, that's a very helpful answer, and I want to turn to that element of that answer where you were talking about local level data, and from the inspiring examples you shared both in video and in text from Maryland and Texas, one of the things that was a recurrent theme was partnership. And I think this may be our last, one of our last questions, but could you talk more about evoking partnerships, particularly at the local level? Some strategies, some challenges, and some guidance.
And, I think first, just looking at the lessons from Project Search, the way that program is structured, where there is a requirement for participation, there's a requirement that the organization designate someone that they're going to send to meetings and participate. That type of consistency is really key, just with any type of a partnership that you're building, that you have consistent people at the table where you can build relationships. And that's often hard to achieve because you have, a lot of turnover within service organizations and people coming in and out. But I think what we've seen is that when people start to see that it is possible to step outside your individual spaces and work together and to create something that one organization can't do on its own, but that can be accomplished with pooling funds and with coming to the table to think about what is actually possible to solve problems, people start to get excited. And it translates into wanting to try other things. And it translates into continued partnerships and different type of ventures. So, while partnership does not come without challenges, and it does require a huge investment of time that often is not reimbursable time, I think what we're finding is that it is one of the most important components that leads to future success. And hopefully, as partnerships require a lot of investment up front, but once you get rolling and you have more shared knowledge structures and you've found successful ways, you've learned about how to work together, sometimes that burden of time lessens a bit, and it can be easier to continue ongoing. So getting past that initial stage, if you can make it through that, I think people are finding that it was worth that initial investment of time.
Well, that's very encouraging. And given that we're speaking of population health from the individual to population, I'll end the question part before we go on to evaluation and credit, and also to ask you after this question if you have any final thoughts. But we have a question about how to encourage young adults who certainly benefit from transition programs, but really don't want to leave high school. How do we motivate young adults to or create opportunities for them to be involved in transition and move beyond what they've known for these many years?
Sure. So you're talking about just the courage that it takes to step out of that safe space of school and into more of the unknown?
Yes, I think
Okay.
that's the spirit of the question.
Yeah. I would say that the way that services used to be set up, as we talked about, it was more of that leap into the unknown, and you didn't maybe have a lot of services set up. And I think what we've learned is that it doesn't have to be quite a leap. It can be more of a bridge or a ladder. And I think the most important thing we're learning from our newer data is that encouraging people to try things when they're still in school and they still have that safety net of supports from special education and linkages to other providers. It's such an important period of time where you can experiment and you can try out different job settings to see what works for you. That's what we're trying to facilitate with the Transition Pathways Initiative is that facilitated exploration, so that it's not such a leap, like a blind leap into the future, but you've had some success, and maybe by the time you leave high school what you're interested in and what works for you and what types of supports you need, and maybe you've learned about the type of resources that are available in your community and a little bit more about what it takes to access those resources. So I think that sort of scaffolded approach where you're taking advantage of everything that you can during those last years of high school is just absolutely vital. And I think that we'll start to see more of that happening as school districts experiment with pre-employment transition services through WIOA, and as we see more programs coming online that really are focused on facilitating high school-based experiences instead of waiting till that last minute.
And thank you for that. And let me guide us all through how we'll spend our last few minutes together, which is, and we're going to ask you if you would, if you have anything you'd like to say in closing, and then I'm going to ask our participants to stay on because we will explain continuing education and the evaluation that people need to do. So, and I'll start thanking you now, but I'll thank you again after your closing remarks. Is there anything that you would like to add in closing to this already wonderful and comprehensive presentation?
Thank you. I would just say that the thing I always go back to from my own experiences and training from just the world of developmental disabilities is that we want to presume competence. We want to presume that people have strengths and abilities that do fit somewhere in our community and that do bring a lot of value to our community. And so we want to really, talk to people about what their dreams are and encourage them and build resources that support those. And instead of succumbing to stigma and feeling like people can't do anything or it's too difficult to employ or it costs too much money, presume competence and know that we can build successful employment within our community, and we can, train providers and develop a cohort of, competency in businesses where employees are seeing value of people with autism and they're wanting to engage in, take a little bit of a risk in hiring somebody. I think those things will continue to multiply, but it's up to us to really foster positive attitudes around employment.
And what a wonderful note to close on. And I want to, as part of the process of thanking you, reflect a comment from one of our audience members about the importance of getting this information out broadly, but especially to those groups who live with the disparities that you reflected in your information, and those of us who are involved in trying to support people both living with ASD and with these social disparities, which I think we're all concerned may be even worsened by our present circumstances. And thank you from all of us for your flexibility in being with us virtually and for the ways that you have integrated your life experience and your skills and producing data and information and presenting it with such clarity that will help all of us renew and revitalize our efforts. So thank you from all of us. Our best wishes to you and your families for good health. And I now turn to all of you attendees and ask you to please complete the evaluation, which is going to appear on your screen in a moment. Please don't log out till you see it. Certificates of attendance will be emailed next week to each of you attendees who were logged on for the entire session and completed the evaluation. I want to thank everyone for joining us at this session of the Developmental Disabilities Lecture Series in our maiden virtual voyage in the time of coronavirus. We wish all of you and your family well. Please let us know how we can be of help and support. And we hope that you will register and join us at future sessions. Stay well. Thank you for completing your evaluation. The evaluation will now pop up on the screen. Thank you to everyone at the Boggs Center, and our good wishes to our community and all our fellow citizens in the US and the world for good health. Thank you all. The evaluation is about